day, everyone. I am Sineha Durgha, Doctor of Niandey, and my metric number is F20A0598. In this video, I'm going to explain my experience and share my experience during my internship program for the past 4 months at Vet Partners Taman Gaya. First of all, I would like to share few of my memories during my internship. Number one, the most valuable experience that I got during my internship is when I rescued the puppy. We named the puppy as Panda. The condition of the puppy when we took him was his face and body was full with fleas. He had skin issues and he also was diagnosed with toxoplasmosis. After treatment, he recovered fully after 2 days, and we gave him to the rescue, or also known as a shelter. One of the memorable memory during my internship was during a cat spaying surgery on a pregnant cat. Since it was my first time looking at a fetus like that, like shown in the picture, it really would be the most memorable memory that I got during my internship. Next, I would like to thank my academic advisor for guiding me the throughout my journey at UMK, who is Dr. Suniza, and I would like to thank Dr. Zul Hisham and Dr. Leonie for guiding me throughout my internship program, and I would like to thank Dr. Chong, who is my person in charge at my industry, and also I would like to thank Kak Zura, who is a vet nurse and also my co-worker at Vet Partners. For the chapter 1, I would like to introduce Vet Partners. Vet Partners is a team of veterinarians and vet paraprofessionals who are passionate about animals' health and well-being. The vision of Vet Partners is healing with hearts, whereas the mission of Vet Partners is to improve health and well-being of all companion animals. Vet Partners was established 20 years ago, which was on 2004. The general manager of Vet Partners is Dr. Tan Chek Nam. We have 14 veterinary clinics, including 2 medical centers located at Nusa Bestari and Permas Jaya, Johor. The general manager of Vet Partners is Dr. Tan Chek Nam, and the practice manager is Dr. Lee E. Liang, and we have 14 branches, and the branch that I worked was at Vet Partners Taman Gaya. The person in charge and the vet at Vet Partners Taman Gaya was Dr. Chong, and there were 2 nurses to assist Dr. Chong, who were Miss Soraida and also Mr. Ong Kok On. There were several products and services available at Vet Partners. For the products, we sell thick medicines and also shampoo. The other products available was vet spray, joint supplement, and medicine for heart and also skin supplement. For the service, we provide animal examination for cats and dogs. And also we have vaccination program, and for the test we have wood lamp test, complete blood test, snap dx, FIP test, and also validity test. Now I would like to explain briefly on services at Vet Partners, which is number 1, vaccination for cats and dogs. Number 2, we can do blood tests for to determine the red blood cell count, kidney function, and also the complete blood count. We also do glucose test to check blood glucose level of the pets. And lastly, the vet can also do microscopic examination, which is usually done for patients with skin issues. Next, chapter 2 is summary of industrial training programs. Some of the activities that I did during my internship was to take care of warded patients. I would usually clean the cage using soap and disinfectant every day, and I will give medicine to the patients orally through IV, or also via subcut. Next, I will assist doctor during consultation. I will prepare the items based on the type of consultation. For example, for wound cleaning, I will prepare tweezer, chlorhexidine, gauze, and VPAD. For vaccination, I will prepare the vaccine bottle and thermometer. Next, I also prepare for surgery. Before the surgery, I will turn on the oxygen tank. I will fill up the isoflurane for sedation. I will also prepare the surgical tools. Other than that, I will also shave and prep the patient for the surgery. During the surgery, I will monitor the vital signs of the patient. I also had experience at front desk handling where I will answer doubts if the customers have any. At the end of every day, I will usually clean the clinic environment by disinfecting, by sweeping and also mopping the clinic area. And I also will do the sales calculation by calculating the total sales for the day and stating the closing amounts in float book. These are some of the activities that I did during my internship. Next, for chapter 3, I would like to explain the three main tasks that I did during my internship. Number one is preparing vaccination for both cats and dogs. The step to prepare vaccine is first we have to insert a needle with syringe into a liquid vial and draw the liquid into the syringe. Next, we have to add liquid into the vial containing powdered vaccine and mix the contents well. And lastly, we have to change the needle to a smaller one for injection. After the vaccine, I will stick the vaccine sticker on the book and place a clinic stamp for the vet to sign. And I will hand the book to the owner during the payment process. The next project that I did was blood tests for patients. There were two types of blood tests, which is CBC and also comprehensive or pre-surgical. For CBC, we usually do for measure the red blood cell count, white blood cell count, and also platelet, which will help us to identify anemia in patients. For pre-surgical, doctor usually suggests to do pre-surgical if the patient is very old to make sure the kidney and liver and other intestinal organs are functioning very well. Next, project 3 is pre-operation preparation and task during operation. For pre-operation, I will prepare isoflurane, surgical tools, and also will prepare the patient. During the surgery, I will give medicine via subcut to the patient and also monitor the vital signs of the patient. For pre-operation preparation, number one, I will usually top up the isoflurane before the surgery, which will be used for sedation. Next, I will prepare the surgical tools. Some of the surgical tools I will prepare is surgical scrub, gloves, blades, IV pot, the shaver, alcohol, iodine, and gauze. To add on, the blade size will be based on the type of surgery that the doctor will do. And I will usually prepare these tools before 30 minutes of starting the surgery. I also prepare the patient before the surgery by shaving the patient's private area and finally applying iodine to the surgery site. Next, for the task during the surgery, number one, I will give subcut to the patient. There are three types of medicine that we usually give, which is tramadol for painkiller, transamin to stop bleeding, and also propofol for sedation. Next, I will monitor the vital signs such as pulse rate, oxygen level, blood pressure, and also breathing rate. I will record this every 15 minutes on a chart. Next, for chapter 4, conclusion. I am truly grateful for getting an opportunity to work at vet partners, I had a chance to show my care and love for my fur babies, and I hope all of the new skills that I learned from vet partners will help me for my future career plans. Next, chapter 5 is suggestion. I have two suggestions for faculty industrial training program, which is to extend the internship period and also monthly academic advisor check-ins. And I also have two suggestions for industry, which is to increase my monthly allowance and also to increase the break time. The two suggestions for myself is to be more confident when doing trying new skills and to improvise my communication skills with customers. Last but not least, appendices. These are the few pictures that I want to share with you guys. And that's all from me. Thank you.